As Alabama transitions into the safer at home order today, that means you can expect to see more people out and about. Now it's more important than ever that we continue to follow the important guidelines to stay safe. Dr. Karen Landers with the Alabama Department of Public Health joins us now. Thank you so much for being with us tonight.
Thank you, Naja.
Dr. Landers, how do you feel about this safer at home order?
Well, clearly, as we look at our trends in Alabama, it's reasonable for people to get back to work to the extent that they can, although we certainly want people to continue to follow safe practices. But we want to remind that while we are getting more people back to work and while certain businesses are opening up, that persons still need to follow the standards that have been recommended for prevention of this virus, including obviously staying at home except when you have to do essential activities or be out. But in addition to that, continuing the social distancing measures, the good respiratory hygiene measures, and the recommendations for voluntary use of face coverings is going to become more important.
Do you have concerns that people might become more relaxed when it comes to some of those guidelines?
Well, Chris, there's always a concern that as the situation changes, certainly, people might relax their behaviors, but I think the most important thing that we have to remember is that our behavior now will affect not only the health of our families, but also the more vulnerable people, such as persons in an older age group or persons with underlying health problems, as well as ourselves. So we have to take a high level of personal responsibility to continue to have this virus decrease in our population and be able to keep the trend downward until we can have a better treatment and also a vaccine.
And that's such an important life-saving reminder. The Alabama Department of Public Health has been tracking the coronavirus cases and deaths, those numbers daily. The goal has really been to flatten the curve. Are we anywhere close to that happening in our state?
Well, we're really at an area right now with cases where we're seeing a trend downward. But it will be important as we see more activities opening back up to continue to monitor that trend and to really see lower numbers of cases that are not linked to, for example, cases in families or close contacts. And again, in other words, reducing the community spread. So it will be very important to look at those numbers to see if we are continuing to keep these cases as low as possible and to keep people out of the hospital because we have to preserve that capacity.
What other important advice do you have for people as we transition into this new phase in our communities?
Well, it's very important to really look at what the safer at home order really means. And by that, I want people to understand that certainly as they go out and engage in more activities, to continue to follow measures to reduce not only infecting themselves, but infecting others.
Dr. Landers, thank you so much for your time tonight.
Absolutely. Thank you.